Let's talk about hematuria or blood in the urine. I'm Dr. Kenneth DeLay, a board-certified urologist in West Columbia, South Carolina, and today we're going to talk about hematuria, which is defined as blood in the urine. There are two types of hematuria, one microscopic hematuria and two gross hematuria. Microscopic hematuria means that it was a laboratory finding only. This usually happens when a primary care physician checks a urine sample as part of routine testing. When they do this, a sample might reveal blood in the urine, and you could be referred to a urologist for further evaluation. The second type of hematuria is called gross hematuria. Gross means that it was visible to the naked eye. So here you would be the one who found it instead of your doctor. You would notice either pink or red urine and possibly even the passage of clots. There are a number of causes possible for hematuria. These can include infections, stones, bleeding disorders, urologic tumors, and medical problems with the kidney, and a variety of less common conditions. If you were referred for microscopic hematuria, the first thing we do is make sure you actually have hematuria. And what I mean by this is we do an examination of the urine under a microscope to see if we actually see red blood cells. This is important because if your urine testing was done with a dipstick only, this means that a test strip showed a possible change indicating blood, but it was not confirmed by looking under the microscope. Sometimes we get what's called a false positive, where this changes, but there's actually no blood when we look under the microscope. If there's no blood when we look under the microscope, no further evaluation is needed. Assuming that you do have red blood cells or had gross hematuria, then we do need to do an evaluation. What we are trying to do is to examine the entire urinary system to make sure there are no abnormalities. This usually includes some type of imaging of the kidneys, usually a CT scan, but sometimes an ultrasound. The bladder cannot be well imaged by studies looking from the outside. Because of this, we need to do a test called a cystoscopy, where we run a small flexible telescope into the bladder and look around for abnormalities. This is usually done in our office under local anesthesia and usually lasts a minute or less. If you actually saw blood, we also do a test called a urine cytology, where a pathologist looks at your urine under the microscope to confirm that there are no cancer cells. Thankfully, we often do not find a cause for hematuria. As long as we don't find anything on the above testing, we usually just follow up by doing urine testing approximately once per year. I hope this content was helpful. If it was, please like and subscribe and turn on notifications so that you can see future content as it is released.